Mrs. Orr, we talked a little bit about your health over in the exam room, and I think we've covered some of the general aspects of what we found today, and basically we're doing all right. But we do have the new finding of the atrial fibrillation that we talked about. I want to make certain you understand that because it's important. It's going to be okay. We're getting everything taken care of, but you're going to be part of taking care of it, and that's important. Okay?
Okay.
So let's cover it again. AFib is irregular motion of the upper chambers of the heart. Should have lub-dub, lub-dub, lub-dub. But in AFib, we have electricity going chaotically around the upper chambers, and the muscle fibers are firing erratically. And what that results in is lack of coordinated contraction. So instead of having, we've got activity like this, and that's firing electrical impulses constantly to the lower chambers. So instead of lub-dub, 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 we have the lower chambers, instead of going relax, fill, contract, relax, fill, contract, they're beating erratically. Sometimes they don't have enough time to fill all the way with blood. And some people get very fatigued because they're not pumping enough blood. So there's 3 problems associated with you for AFib. So problem number 1, excessive fatigue, out of proportion to your life's activities. Problem number 2, feeling your heart racing very fast in your chest. And you haven't had that. Your heart rate's in the low 80s, and that's just fine. And your body has done all that on its own. Great for you. Third problem, and we want to spend some time talking about this today. When the upper chambers are sitting like this, blood isn't moving quickly out of them. But when blood isn't moving quickly, it has a tendency to form clots. Now, why is that a problem? It's a problem because the clot can break off and go downstream. When it goes downstream, it's going to get pumped out to your body. Unfortunately, the first stop is these big arteries that go to your brain. And the most devastating thing that can happen is for that clot to go to your brain. Block an artery in your brain, cause some of the brain tissue to die, and that's what we call a stroke. Your risk is increased because of some of your factors. We have some fancy calculations to take a look at that, called CHADS and called CHADS-VASC. But what you should know is that your risk is more than minimal in the several percentage chance per year of having a stroke. And strokes associated with atrial fibrillation tend to be severe. So I'm not trying to scare you. I am trying to get your attention. You with me so far?
Yes, I am.
Okay. What are the 3 problems going on with AFib? Can you tell me?
What are the 3 problems?
3 problems that could be associated with you. Rapid heartbeat?
Oh yeah, the rapid heartbeat. But I haven't had that, right?
Haven't had that.
Okay, and then
lack of pumping.
The lack of pumping.
With fatigue.
Yeah.
And you haven't had that.
I haven't had that.
And third?
The not the clot situation, but the pooling.
The clot forming and
yeah,
moving
the clot
downstream.
and moving downstream, right?
And
right.
if it goes to your brain?
But I haven't had that, obviously.
No, and we don't want to have that.
Because that would be the stroke thing.
That stinks. Strokes are forever.
Yeah.
So we want to prevent that. And the way we prevent that, at least for you at this stage, is by thinning your blood so that you can't form a clot. And for you, we're going to use a medication called warfarin.